A fourth surge of COVID-19. It hasn't impacted Idaho much, at least not yet, but state health experts are keeping a close eye on what other areas of the country are dealing with right now. Major cities like Los Angeles and Vegas are going back to masks, even for vaccinated people. We'll have more on that in a moment. But first, what does this mean for Idaho? Are new restrictions in store for us as well? And with a vaccine that is only available to Idahoans 12 and older, what does this all mean for schools? The school year is about a month out for most students. And as of right now, every major school district in the Treasure Valley will begin without mask mandates in place. Our Joe Paris talked with an Idaho medical expert to get some insight.
On the COVID front, summer 2021 is going better than what we saw a year ago. Last year, on this day, Idaho reported 550 new cases of COVID. The latest daily case report from the state on Friday showed 161 new cases. So while things are feeling more and more normal, some experts are concerned that people, specifically those unvaccinated, have given up on COVID precautions, and this could help lead to a resurgence of COVID in the fall. One data point to look at, vaccine rates in Idaho.
Something like 45% of us fully vaccinated, which means if you were following the CDC advice, 55% of people we see out and about should be wearing a mask. I can tell you at least the places where I've been traveling around the Treasure Valley, it's nowhere close to that.
Dr. David Pate is the retired CEO of the St. Luke's Health System and an Idaho medical expert. He explains the thinking as to why places like Los Angeles County are now going back to masks for everyone.
Let's get ahead of this and let's try to stem this rise in cases now. And of course, the best way to do it is what we've always talked about. Mask if you're out around people, try to avoid getting into large gatherings, try to keep your distance, and of course, get vaccinated.
If you are eligible to get a vaccine but still have not, Dr. Pate presents this fact for you to consider.
When you look in June, more than 99% of the deaths due to COVID, all unvaccinated people. When you look at our hospitals with the COVID patients now, over 97% are unvaccinated people.
So what will Idaho look like in the coming months? Well, it really is wait and see. But if things continue the way they're going, Dr. Pate believes there could be implications for the upcoming school year, especially at the elementary and middle school level where there's no vaccine yet for those 12 and under. Dr. Pate says a recent telling trend to him is how summer camps are handling COVID.
What I thought is if we had smooth sailing with summer camps, then yeah, maybe we're going to be okay. But if we had a rough go with summer camps, I'm concerned. And we're having a rough go with summer camps.
The introduction of the more contagious Delta variant is also a concern for Pate. Recently, he studied how other countries are faring with schools in COVID. He says there are major differences between now and a year ago because of the Delta variant.
Last year, we really, even with the infections we saw in school, it didn't really spill out into the community to any notable extent and didn't contribute to community spread. What we are hearing from every country that's dealt with this is schools now do contribute to the community spread. And I think that's what's going to happen here. That's what I fear is going to happen.
Idaho experts believe that schools could see challenges with COVID outbreaks among younger unvaccinated students this fall, especially with significantly reduced protocols and optional masks in many school districts. Pate questions why students who are not eligible for a vaccine yet are being told that they don't need to mask up. Masks were very helpful in cutting down on the spread of the virus last school year and helped prevent students from bringing home the virus, especially to families who are not vaccinated.
We're going to get to a point in the first part of the school year where younger kids can get vaccinated. And just like last year where we said, let's give teachers a chance to get vaccinated before we change these restrictions, we ought to do the same thing for the kids.
And something else that health experts are keeping an eye on heading into the fall are flu and RSV numbers among students. And really, because the masks and how effective they were and are, we did not see a lot of flu inside of elementary and middle schools because the virus wasn't able to spread like it would because of those masks. So Kim, Dr. Pate and other medical experts are going to keep an eye on the flu numbers, and they are expecting to see a lot more flu and RSV than we did see last year.
Well, I want to ask you, Joe, on something Dr. Pate said in your story. He said we are having a rough go with summer camps. What did he mean by that?
Yeah, across the country, country, Kim, there are some summer camps that are reporting clusters or outbreaks of COVID amongst kids that are 12 and under because there's no vaccine for them. One specific case I talked about with Dr. Pate was a camp over in Oklahoma, and the CDC was actually studying what happened there, and they saw that 20 to 30% of all the kids there ended up getting COVID and spreading it around. And the bottom line, Kim, is that with no vaccine for these kids, if a virus gets in with a group of them, it's going to spread, and it's going to spread until there's a vaccine.
Oh, I just want it to be a normal school year, Joe, like I'm sure a lot of parents out there watching tonight want it to be as well, and we hope it is. So far it is. We haven't heard otherwise, but again, we're just watching other areas to see what happens so that it doesn't happen here, right? That's kind of the bottom line, Joe?
Absolutely, yeah. Keeping a close eye.
All right, Joe, thank you.